Developing news on the coronavirus, then an announcement from the White House late this afternoon. The United States has now declared a public health emergency.
President Trump is set to ban foreign nationals who pose a transmission risk from entering the country. So far, there have been 6 confirmed cases in the U.S., including the first person-to-person transmission. Eyewitness News reporter Molly O'Brien has the details on how hospitals here at home are preparing. Molly?
While the U.S. government takes historic steps to contain the coronavirus, the CDC continues to believe the immediate risk to the larger American public is still low. Local hospitals are coordinating with emergency management, preparing for an outbreak.
6 confirmed coronavirus cases in the U.S., 121 cases pending. For the first time in decades, U.S. citizens evacuated from China now in a federally mandated quarantine. Closer to home, local hospitals working with the CDC and the Rhode Island Department of Health.
We're monitoring the situation hourly.
Dr. Sooner says Lifespan mobilized, preparing for potential spread of the virus.
We're revamping our screening protocols regarding patients with influenza-like illness, fevers, cough, shortness of breath.
Sooner says they're working with infection control personnel and emergency preparedness.
We're making sure we have enough supplies of masks if it becomes necessary, and revamping all our protocols regarding isolating patients in the emergency departments and the hospitals.
The CDC not recommending face masks for the general public at this time.
No need to panic right now. There are no large masses of infected people in the United States, so there's no need for people to wear masks on the streets in the United States.
And there are still a lot of questions as to how the virus is transmitted. A report in the New England Journal of Medicine suggests it can be spread by people who aren't showing any symptoms. I'm Molly O'Brien with Eyewitness News.